The president said it's a triumph for the American patient. Is it?
So like most of these most favored nations deals that Trump is doing with drug companies, we don't know the full fine details of this yet. The basic parameters, are similar to other deals that Trump has done so far with companies like Pfizer or AstraZeneca. This is kind of the obesity drug deal that Trump is doing. They're talking about prices being offered starting for some Medicare patients with certain conditions as $245 a month with a $50 copay. And then for Lilly's drug, $299 for the lowest dose. But what we don't know is will all Medicare plans have to cover it. So there's just a lot of details we don't know yet, but this is definitely a win for Eli Lilly and Novo Nordisk to get these deals with the administration that spares them from tariffs for 3 years. And both companies have also gotten a special priority review voucher from the FDA for their new pill obesity drugs that will enable those to get to the market faster in exchange for offering them at lower cash prices. So the company's got something out of it today. So it's a win, but look, how much overall for how many people this lowers prices, remains to be seen.
Yeah, Bob, how does it compare to a number of the other deals we've seen the Trump administration strike with, call it Pfizer or other drug manufacturers?
Yeah, the basic outlines are similar. So the companies agree for medicines going forward to adopt most favored, for new medicines going forward to adopt most favored nation pricing, where they want to price it higher in the U.S. than other wealthy nations. They agree to offer lower prices to Medicaid and offer some low prices on Trump RX, this new platform for direct cash purchases at lower prices. So it's a kind of a similar format that they've done. What we don't have is full parameters of, how it all kind of nets out, how much money will be saved, and how many more people, really will get access to lower prices that don't have it now, because there are a lot of people that are insured and get good prices now and don't need this. So how many people will go through these other platforms? For this one, I think one of the biggest questions is how many more people starting next year in Medicare, that's the government program for the elderly, will have eligibility to get these obesity drugs, at lower prices that is not available at all now yet. And that's not totally clear yet. They're having a briefing in a couple hours with more details on those plans, but they're talking about $245 a month for obesity shots in Medicare for certain patients who also have other conditions besides obesity, like prediabetes and heart conditions.
Well, that's what I wanted to ask next. If you think through the costs of the U.S. healthcare system, you think through the potential savings if a patient who, has prediabetes or is at risk of heart failure, being on a weight loss drug could actually save the government more down the road, whether they're a Medicare or Medicaid. How is that factoring into kind of at least your sources thinking through lower prices for some of these people with comorbidities?
Yeah, we just don't know the details of how this Medicare program is going to work yet. Like, for example, Medicare right now, Medicare prescription drugs, that goes through individual plans, and they differ from plan to plan. And right now, under law, obesity, pure obesity isn't allowed to be covered at all now under law. But they're talking about expanding this to people with obesity but have certain other conditions treated by the drug, like prediabetes. But the fine details, we just don't have them yet. So how widely available they'll be and how many people really will have access to these drugs at this lower price, we just don't know yet.